Hello, I'm a podiatrist, and in this presentation I'm going to talk about the podiatric management of foot ulceration. So as you can see, this is a lovely picture of ulceration on the foot. So in this presentation I'm going to talk about the materials, insoles and footwear that podiatrists use to help offload the pressure on the foot. So these are some of the different materials that podiatrists use for pads to help offload the foot. So they use semi-compressed felt. They also use haploband mixture felt, closed cell rubber, pour-on, Lunasoft and Foma felt. So this is semi-compressed felt. This is the most common material that's used by podiatrists. You can see that it's got different thicknesses as well for different pressures. For ulcerations they tend to use 7mm or 10mm. This is Haplofix. It's also padding used by podiatrists. Again, it comes in various thicknesses and is easily cut out and shaped just like semi-compressed felt. This is closed cell rubber. It's used for cushioning and for deflecting the pressure away. It'd be more durable than felt. This is pour-on. It's a really good cushioning material. It's used mainly in covers for deflecting pressure, and it's very durable and it's able to help absorb the shock for the patient when they're walking. So these are the prescriptions used to offload pressure. So this is an example of a prescription that a podiatrist will use. This is good as it shows you the versatility of what we can do with pads. So as you can see, here is a valgus dome cutout to help support the arch. Then on top of that there's a PMP of semi-compressed felt. This is all 5mm. Then there's a cavity cutout where the ulceration is. This allows the pressure to deflect away from this area to allow it to heal. Then if you can see in this picture, they use a tape called MeFix, which just helps secure the pad on. It will help it stay on longer. These are examples of donut pads. Again, this is made out of semi-compressed felt. So it's just a simple donut pad with a hole in the middle just to help deflect pressure away from it. In these pictures, it's an example of the first and third metatarsal heads being deflected. Again, this just reiterates a closer picture of the pad to help deflect pressure away. These are examples if you get interdigital ulceration. So basically if you get an ulceration in between your toes, these wee silicone interdigital props can help just reduce frictional forces in between the toes and help prevent digital ulceration. This is an example of a plantar metatarsal pad. So basically you can see the ulceration here and the PMP with a U cut out of it just to help deflect pressure away from the area. This is a similar sort of pad, only in this occasion it's deflecting the second met head as opposed to the first metatarsal head or the third metatarsal head. This is another example of semi-compressed felt, only in this occasion it's a PMP with a wing to the first and a wing to the fifth. So it's deflecting two areas in the one pad. This is a Foma felt pad, so you can see it's dual layers. You can see like a pink layer on top and then like a lighter white layer underneath. It just helps for extra cushioning. And in this picture it's offloading the second metatarsal head. So choosing a device, there's a number of devices for offloading available. There's a choice of the device. It depends on the type of wound, the patient's mobility and how active the patient's daily life is. Selection must be undertaken in consultation with the patient to achieve compliance, so that they actually will make sure they wear the device. So these are different examples. So you can get a total contact cast, which as you can see in the picture is the white cast. This is the gold standard for offloading non-infected neuropathic ulcers. It's a fiberglass cast which restricts ankle movement. It spreads pressure across the plantar aspect of the foot, and it helps eliminate problem of non-compliance as the patient can't take it off. Most ulcers with this type of cast will heal in 6 to 8 weeks, and it's suggested that up to 90% heal in 12 weeks. This is another type of device which is called a removable walker. It's similar to the total contact cast. It restricts movement at the ankle and the foot. It redistributes pressure again across the plantar aspect of the foot, so underneath the foot. It can be removed to allow the wound to be inspected to see how it's healing. It's removable by the patient, which can be an issue as patients sometimes don't like it and take it off. This is an air cast. How it works is there's two plastic shells, each with an air pocket in it. There's a soft insole inside just to help for cushioning and deflect pressure, and for shock absorption properties when the patient's walking in the gait cycle. It can be secured with cable ties or casting material, so it cannot be removed by the patient, which stops the problem of non-compliance. This is ankle foot orthosis, so it's used to aggressively offload the plantar aspect of the foot or heel. It's quite an expensive device as it's usually custom made, and it's used for long-term ulceration management. This is a Charcot restraint orthotic walker. It's beveled ankle foot orthoses. Its aim is to limit all ankle and foot motion and stabilize the Charcot joint. And it has a rocker bottom, which just helps the patient walk because it's so stiff and rigid. So then insoles and orthotics. This is mainly what podiatrists would offer. So insoles are a long-term solution as opposed to using the pads, which tends to be short-term. So insoles can be made from a wide range of shock absorption materials or cushioning materials, which can be palliative or functional. Pads can be added to deflect or redistribute pressure away from the high areas of pressure. So again, the types of material that podiatrists would tend to add on is things like Poron that will help deflect pressure away, and closed cell rubber as well, and EVA. Orthoses or total contact insoles can be used to relieve pressure on specific areas of the plantar aspect of the foot or to achieve offloading. Footwear is also very important. You can get temporary footwear, so things like a trauma sandal, useful if needed to accommodate for bulky dressings if ulcers have to be dressed, can be tailored chair side to fit the patient's needs, which means it's quick and easy to alter. Then you get therapeutic footwear. Patients with a history of ulceration should be considered for specific therapeutic footwear. It's used as protection for patients whose feet have ulcerated in normal footwear. Tends to be wider and deeper to accommodate the feet with deformities, so if they get like Charcot foot with diabetes. It can be used in association with a total contact insole to redistribute pressure, and this is just an example in the picture. So to summarize, insoles are effective at offloading the pressure. It's essential to offload to facilitate wound healing. There are a number of different offloading devices available. A thorough assessment should be undertaken to determine the most suitable device for the patient. A patient-centered approach must be undertaken to ensure patient cooperation to achieve effective offloading. The main things podiatrists will use in short term would be padding and strapping, and then in long term would be insoles, or to get the casts can be referred on to an orthotist or specialised units like the diabetes unit in hospitals. Thank you for listening.